Welcome back! In today's video, we're going to be talking about a very important topic, antidepressant withdrawal syndrome. And in this video, we're going to specifically talk about what antidepressant withdrawal syndrome is, why it occurs, which medications are the highest risk for causing antidepressant withdrawal syndrome, and finally, what can you do to help prevent antidepressant withdrawal syndrome? First of all, antidepressant withdrawal syndrome, also known as antidepressant discontinuation syndrome, occurs in about 56% of those who take antidepressants and try to come off of them. And nearly half of those people, about 46% of those people, will experience severe withdrawal effects. And these withdrawal effects can last anywhere from 5 days to 79 weeks, with a mean of, on average, lasting at least 6 weeks. So, what are these withdrawal symptoms that we're talking about? So, to best describe the withdrawal symptoms, the mnemonic FINISH can be used. F for flu-like symptoms, I for insomnia, so disturbed sleep, feeling restless, vivid dreams, and even nightmares can occur. N is for nausea, stomach discomfort, gastric distress. I is for imbalance, so you can feel a little bit of vertigo, lightheadedness, and even some dizziness. S is for sensory disturbances, which can include those electrical-like sensations or brain zaps. And H is for hyperarousal, so like feeling anxious, agitated, or even irritable. So why does this happen? Well, what happens is when you take an antidepressant, those serotonin transport systems in your brain that help to modulate and regulate serotonin levels in your whole body actually start to become lazy because the medication is now providing the benefits of increased serotonin by either blocking those receptors or agonizing some of them to work a little bit better. And so what happens is that those receptor sites and those transport systems, they end up, let's say, going to sleep. So they're asleep for a while depending on how long you've been on an antidepressant, which can be a factor in how you will experience withdrawal symptoms. However, when you go ahead and just take the medication away, the brain goes into a state of alertness and sort of like an alarm, telling those areas in your brain, wake up, wake up, wake up, wake up. It's time to start acting again. We're no longer getting the help from the medication. So those systems try to activate, and all of a sudden your body is flushed with all of this serotonin and it's trying to regulate it, and the brain can't keep up because those systems aren't working like they were before. And this takes time for the brain to reestablish normal functioning of those transport systems. So that's where the abstinence syndrome or the withdrawal syndrome symptoms manifest. It's a result of the disruption of those serotonin transport systems or serotonin receptors. It has nothing to do with addiction. Addiction is a whole different animal, which I will be discussing in another video. So therefore, subscribe to the channel so you don't miss out on that video, because I will be going into some detail about addiction versus antidepressant withdrawal. And so there are medications that come with the higher risk of this abstinence syndrome. And in this table here, which you can get from that article, Antidepressant Withdrawal and Rebound Phenomenon, that article is available. It's an open access article. Actually, both of the articles that were used for this video are open access. So you should be able to click on those links and access those articles and review them for yourself. So this table actually came from that article. And what you'll see here is that there is a very high risk of this abstinence syndrome with tranylcypromine, which is an MAOI antidepressant, along with phenelzine or Nardil, which is another MAOI antidepressant, which we don't see a lot of because a lot of prescribers have moved away from prescribing MAOIs. Even though they're very effective treatments for antidepressants, they come with a lot more side effects, risks, and as you can see here, a very high risk of abstinence syndrome. And then you'll see the next level, which is high risk. So high-risk medications or antidepressants are going to be paroxetine, which is also known as Paxil, venlafaxine, which is also known as Effexor, and venlafaxine, which is also known as Pristiq. Next, you see the moderate risk. So you see citalopram or Celexa, escitalopram or Lexapro, sertraline, which is Zoloft, duloxetine or Cymbalta, and vortioxetine, which is also known as Trintellix. And then your low risk, fluoxetine, Prozac, which because it has a very long half-life. And then milnacipran is an SNRI that is used for the treatment of fibromyalgia, but is not approved for treatment of major depressive disorder. However, it can be used off-label for that. And then you'll see no risk for medication called agomelatine, which is used in Europe and Australia, but is not used in the United States because it has been shown to cause liver toxicity. So you will not see that medication used in the United States. And then there's an unclear risk for mirtazapine, also known as Remeron, and bupropion, also known as Wellbutrin. And that is because there's not a lot of evidence or research on withdrawal syndrome with these medications. However, from my experience, though I taper patients off of these medications if they've been on them for longer than 8 weeks, I have had no reports of abstinence syndrome or withdrawal syndrome from patients that have come off of these 2 medications. Same is true for fluoxetine. I have not run across patients who experience withdrawal symptoms with fluoxetine. But again, I do take precautions, and if you've been on a medication for longer than 8 weeks, I will still taper you off of it. Which leads us to the prevention aspect of antidepressant withdrawal syndrome. You can prevent or at least minimize the impact of antidepressant withdrawal syndrome if you can taper the medication slowly. So abrupt discontinuation of your antidepressant can lead to this antidepressant withdrawal syndrome, and 56% of patients will experience this. However, most providers will go with old evidence and try to taper you off in like 2 to 4 weeks, and that is unfortunate. I believe that you should be withdrawn very slowly and at least over 3 months. And just as I discussed in that video that I made on withdrawing from benzodiazepines, this is individualized. So this will have to be a process that you and your doctor will discuss, and as your doses are decreasing, you'll have to make sure you communicate with your provider what symptoms you're experiencing, if any. And if you start experiencing some uncomfortable withdrawal symptoms, that is a clue that you want to stay on that dose for a little bit longer before jumping down to the next dose, or even coming down a little bit more slowly, which is where liquid formulations of these medications come in handy. Another thing that you can do, especially if you're on venlafaxine or paroxetine, these are the 2 hardest to come off of, believe me. And so what you can do, and what I have done, is cross taper to a medication with a longer half-life like fluoxetine. And if your doctor is unfamiliar with how to cross taper, you can introduce them to rxswitch.com. I'll have the link to that down in the description, and that'll help show them how to cross taper. However, keep in mind this is just a guide, and you may need to stay on one of those levels of cross taper for a little bit until you adjust as you're cross tapering. The reason you'll do this is because with venlafaxine and paroxetine, because they have those really short half-lives, it is almost impossible to just come off of them. So when you cross taper and you use the fluoxetine that has a very long half-life of up to 5 days, and then its metabolite can be in your system for up to a couple of weeks, it'll actually help to ease those withdrawal symptoms. And then once you completely switch over to the fluoxetine, you'll be able to come off that a lot easier than the venlafaxine or the paroxetine. Now, if there's a reason why you can't use fluoxetine because it can inhibit the metabolism of some medications, then you can try another SSRI with a lower risk, such as sertraline or even escitalopram can be used as a cross taper. Those are going to be a lot easier to come off of than the paroxetine and the venlafaxine. Another tip to help avoid abstinence syndrome or to lessen its effects effect is try not to be on these medications for longer than 6 months to a year. Your course of depression is typically going to be about 6 months to a year. Same thing with anxiety. And by that time, if you're working with a provider who uses a holistic approach and is helping you to build skills to lessen the impact of your symptoms, by 6 months to a year, you should have a lot of tools already in your toolbox to support you. So when you start coming off of this medication, you'll have built a lot of tools to use to help lessen the impact of this withdrawal syndrome and even a rebound syndrome, which can occur with coming off of your medication. And another tip is to only use the minimum dose required for your symptoms. So once your symptoms have resolved, you want to stay at that dose and maintain that for that 6 months to 1 year and then taper off. It'll be a lot easier to come off if you're on a minimum dose versus a maximum dose, or even if you go above the maximum dose, it's going to be harder to taper down and come off of that medication. So that wraps up this topic on antidepressant withdrawal syndrome. Do you have any experience with antidepressant withdrawal syndrome? Would you like to share it with us? Please do drop it in the comment section below. And if you have any questions about this topic, let me know. I'll be happy to answer any questions that you have. And please be sure to share this with who you believe can benefit from this information. And as always, I thank you for watching, wish you well on your mental health care journey, and I'll look forward to seeing you next week.